joining us, and please do join us after the lunch at 2 p.m. Thank you.
Thank you, Aarti. Thank you, gents.
Thank you, sir.
Most of the times where the students can be assessed at the end of the course, where we can collecting the evidence about the learner's achievement, as well as in the progress test, what we are doing in the assessment, also internal assessment we are doing. So we can collect the progress of all the test, as well as at the end of the course, as well as all the evidence that can be collected where the candidates or the students are involved in certain field. Where should the student be assessed? So I told that environment is very, very important. So either it is a hospitals or in the college. So examination halls where the students is writing the examinations, and clinical examinations in the hospitals where the students is performing the practicals, or in the workplaces, in the community. These are the places where we can assess the students. So for this everything, we have to blueprints. So the blueprints is nothing but about the details of the curriculum. Okay, what are the topics are involved, from which topic, how much portion will be taken, marks will be given, and which is the must know area, what are the nice to know area or desire to know area. All this has given in the blueprints, and how it should be managed. The process should be managed by careful planning and allocation of time and resource. So when you are assessing the things, you have to, certain management should be there, and for that you must have a resource allocation, time and resource, which is very, very important, and the coordination of each phase in the curriculum, and computer and information technology, because most of the times we are conducting so many things through the computers and information technology. And clinical skill centers. Now most of the institute, they have a centralized clinical skill centers where they have simulators and simulate virtual patients. Okay, that can help the students where they cannot where there will be no risk to the patient, real patients. Okay, if they are using the simulators. So before designing the assessment tags, you must have certain idea in your mind where you can going to elicit the high order cognitive skills and develop a consequential basis for test score interpretation and use. Designing assessment tags must be fair, which is free of bias. It is generalized. It has some ensure the quality of the content. It should be for everyone, whether the student is low achiever and high achiever. It should be the same for everyone. You should not be biased, free of bias, and ensure the quality of the content. And it can contain the entire coverage given in the curriculum. It has a high fidelity assessment of critical abilities. It is contextualized and meaningful to the students' educational experience, and it is a cost effective. So it will not affect whether the students is a low achiever or a high achiever. Okay, it should be for everyone equally. You have to see. So there is a different labels, and for different label there are different types of examinations we are conducting. Okay, for if you see that knows and knows how, which is the cognition levels, and the shows how and does, which is the behavioral, person's behavior, student's behavior. You can see that only the written examination is can recall type, and when the students is only in the platform of knows. If you go little above knows how, where you can give some clinical problem solving. If you go little higher, shows how, where you can see the competency of the persons. And if you go to the does, the performance of the candidate you can achieve. If the person has able to do some assessment at the dose level, then you can see you can assess the person's behavior. In the shows how, it is the competency of the persons, and knows how, just application of the knowledge, and knows only the knowledge will test it. So if you go to the peak of the triangle, your competency level is increasing from cognition to the behavioral levels. And you can see that these are the different methods are there to test the assessment and their cognitions and the behavioral labels. There is a mini sex, mini PAT, CBD, case-based discussions, and direct observation of the procedural skills, and which can indicate what type of output we can get. You can see the outcomes here. You can get the dose level, clinical, ethically, competency, and the different outcomes in the knowledge. You can see the communication, professionalisms, all these things, output we can expect by applying the different assessment methods. Now, there are 4 types of evaluations as per the Kirkpatrick's triangle. And you can see the 4 levels. There is a reaction, learning, impact, and the results. Okay, you cannot expect everything at a time. So it will take time for the students to achieve the results. Okay, so the level 1, did the learners enjoy the training? When you are giving some training, whether the learners is enjoying, or when you are giving in the learning process. Level 2, did learning transfer occur? Whether whatever you have given or learning, whether the transfer is occur or not. In the impact, or level 3, did the training change behavior? Whether there is any behavioral changes in the by giving the training. Did the training influence performance? So these are the different level of evaluations. And if you see the level 1, how did the participant respond to the training? When the participant is given any training, how the participant is responding. In the level 2 learning, have the participant applied what learned from the training, whether he applied anywhere. Or in the behavior, how much did participant learn and from the training and have their skills improved. In the last one is the results. What benefit has the organization experienced as a result of the training? So these are the different level of evaluation that can be assessed at the end of every training, every CME, when you are giving any training program. And this is the very important thing. How do we know that if students are in difficulty in learning process? That can be done only by going through their portfolio and assessment on regular basis. You have to see the assessment of the students on a regular basis, and it can go to see the portfolio. It is nothing but the collections of the evidence of their what they are doing in the period when they are in the department. So already I told that there are different types of students are there, who are the low stake, who are the high stakes, and medium stakes are there. Okay, but we are not going to discriminate. This is only to just to know that how much they are grasping the learning, how much they are grasping the learning from the environment. Like that, you can see the low stakes, can be assessed by the formative assessment. Medium stakes, they can a continuous assessment, and high stakes, they have the professionals. Okay, they will consider. There are certain skills, even they have the skills, but they are not able to perform the reliability, high reliability due to certain factors, because too few stations or too little testing times is there. So you cannot assess the high reliability. And sometimes unreliable patient or inconsistent role players. Sometimes the examiners are different way. Okay, sometimes that is idiosyncratic examiners. Sometimes it can one of the factors where we cannot assess the high reliability of the assessment, and due to some administrative problems. All of you are aware about the different type of written assessment, starting from essay questions to the multiple questions, extended matching questions, modified essay questions, and later now there is a script concordant test and situational judgment test, which is giving the questions to a candidate at that particular moment, and he can judge and give the decisions about the situations, how to handle and all these things. These are the high order skills. Clinical performance-based assessment is there to test the practical skills, learner competency, and this is one of the clinical and performance-based assessment is one of the cornerstone in the qualifying examinations. Already I told that blueprint is very, very important for all the assessment because in the blueprint, everything is clearly mentioned, what to be tested, how to be tested, what are the portion to be tested, how much marks will come from that particular portions. There will be no overlapping between the theory and the practicals. Everything will be given in the blueprint. Okay. This is one of the examples of the blueprint. You can see that they have the systems and the physician task. These are the different systems are there. They choose that history taking will be taken from the CVS and the GIT, and the respiratory only physical examinations, renal only data interpretation. So they have the particular important topics they have to choose from the particular systems, and that should be given to the students for the exam. Okay. So preventions information can be only taken from the CVS, how to prevent the heart attack and how to prevent that, all these things, and the epidemiology from the CVS. So now you can see that the next part in the blueprinting, you can see that when they have taken history taking, they have to ask for the chest pains. So these are the way you have to prepare the blueprint in advance, and it will be with the coordination of the entire department. It is not like that only one can go with the blueprint. So it is with the coordination of the entire department approved by the medical educations, and then we can implement. And what are the methods to be used for the particular topics, that also to be mentioned in the blueprint. So MCQ also, we are testing the candidate assessment, but there are so many problems. The proper MCQ is very difficult to make, and before getting the good MCQ, you must aware what are the common problems with the MCQ response. Sometimes there is a distractors which is clearly implausible. Some of the MCQ, they have always and never, which is not good for the MCQ. And sometimes there is a distractors which is very one word, or which is a very long response. The guess can be given by the candidates and they can take the long answer. Distractors, which can be most of the time it is correct. All of the above, none of the above, that should be not allowed in any type of MCQ. Okay. And overlapping between the responses. Okay. Unambiguous. So these are the certain things which, while you are preparing the MCQ to assess the candidates or the students, to be avoid. So MCQ must be having a clarity. Okay. Already I told that it must have a clarity. It should be consistency. Okay. It can be response at roughly equally length. Accuracy will be there. Okay. And organization, right? Question in an organized way, in the logical order. Okay. So these are the 4 important criteria for making a good MCQ. It should be have a clarity, consistency, accuracy, and it should be organized in a logical order. So these are the different competency which is assessed for the residents in the clinical setups. You can see that these are the different competency. If you go to the evaluation of the mini clinical evaluation of the exercise, we can getting the competency of the interviewing skill of the residents, how the resident is examining the patients, what are the qualities in professionalism, judgment in clinical aspects, how the resident is counseling the relatives as well as the patient. Okay. So these are the competency can be assessed in the mini clinical evaluation exercises. Already I told that portfolio, it is a very, very important, and it can be different from the logbook and portfolio. Both are different things. Okay. Portfolio is just for the assess. We are just collecting the evidence as an assessment tool. Okay. It relates to the work of a doctors and reflect a holistic and integrated approach to the medical practice. It is the work of the doctor, what the doctor has been done for the period when he is in your department. Okay. It is a collection of evidence in the longitudinal manner over a period of time, demonstrating that learning has taken place. Portfolio will tell that only the learning has taken place. It cannot tell about the competency of the person. Okay. The candidate or the student is there in your department, and he has taken place. The learning has been taken place. Okay. And it can contain both the quantitative graded evidence as well as the qualitative description of the students' presence in the department. So these are the evidence in the portfolio. You can record of procedures carried out by the students. Suppose if the person is doing the autopsy, then how are the procedures adopted? that can be recorded in the portfolio. If the person is doing some autopsy, that can be recorded in the video recording, and then student interaction with the patients also in the clinical setups, result of the students' performance in formal assessment, including OSCE and written assessment. Okay, so all these things you have to be keep in the portfolio for your assessment. Already I told that there is a difference between the portfolio and the logbook. Portfolio is a part of formative assessment. It's support of the students' learning. Okay, it support the students' learning, whereas the logbook during the award postings develop the target of achievement with rigorous expert consensus. It is the achievement. If someone is getting some achievement, it should be in the logbook. Assessment of the actual experience. Here you can putting the experience of the candidate in the logbook. Okay, but that is portfolio. It is only the learning procedure, what the students in the department, what he is doing day-to-day activity has mentioned, but what the experience the students get after performing certain test. Okay, and required for validation actual performance in future. So logbook is more important than portfolio. Portfolio is only supporting the students' learning, but logbook is helpful for the assessment of the experience of the students in authentic setting. Now coming to the role of the teachers, what is the role of a teacher as a teacher for the students? Teachers can inspiring the learners to change and develop their personal, social, and professional skill. If there is something lack on the student's part, the teachers can inspire. Okay, you are lack on that, and in the professional skills, and it can inspiring the students. And in this respect, the ultimate aim is to enable the learners to understand how to take responsibility for their own development. So the teachers has two important functions. One is to inspire to the learners for professional skills, and also ask them to understand their responsibility for their own development. So the teacher act as an authority, demonstrators, facilitators, delegated, and hybrid when it can combine any four of the things. So the first responsibility as a teacher in the first MBBS, suppose the teachers, when they are come across the students, they have to first ensure that learners are enrolled into the correct course or not. Because there are, if you see that some cases in the first MBBS, the students are failing or whatever maybe. So this is the very important of the teachers to know that whether the proper candidate enroll onto the correct course or not in terms of meeting the needs, abilities, and aspirations. Sometimes the candidate is failing 4 times, 5 times. So that it can be told by the teachers in the beginning if the candidate is not performing well. Okay, so they have to ensure that the learners are enrolled in the correct course. Like the students' portfolio, there is a teaching portfolio, which is very, very important to capture the evidence of one entire teaching career. Okay, it should be very important for the teachers having a portfolio where these components like thoughts about the teaching, what the teacher is going to teach, what is the thought, documentation of the teachings, effectiveness of the teachings, what are the materials demonstrated to the students for the learning, activities to improve the instructions, contribution to the teaching professions and or your institutions, what are the honors, awards, and recognitions gained by the teachers. So all these components parts will be in the teacher's portfolio. So what is the need for assembling all these things as a components? So it can only give us idea about the teaching effectiveness of that particular teachers and the teaching skill. It can refine by getting all these components, by getting the feedback, he can refine his teaching skills. Okay, and for that he needs the comments or feedback from the peers. What is required for of a good teacher? If you want to be the good teachers, then what are the things to be required? What should be learned or taught to the students? What you are going to taught? Okay, what are the learning outcome is given in the curriculum? Okay, whether you are teaching in the organized way or not, what is given in the curriculum? Effective to the students or not? Okay, and how the learning and the students progress is assessed. Whatever you are teaching to the students, how you are going to assess that one. And at the end, whether you are getting the goals or objective which you are going to teach. So this is the requirement for the good teacher for the particular subject or the lessons. So there are different attributes are there for the clinical teachers as a good or the bad clinical teachers. Okay. So the good clinical teachers as always helpful and available to the students. Okay. Good clinical teachers. But if you see the bad clinical teacher, intimidating and teaches by humiliations. Okay. And the good clinical teachers, they are the patient oriented with problem solving, and the bad clinical teacher, they are the disease oriented and factuals. Okay. And a good clinical teacher provides students with the opportunity to practice their skills. Bad clinical teacher does not encourage the student to practice with their skills. Okay. So there are so many attributes are there which can decide whether the teacher is a bad or good. Whoever the teachers join in the medical institution, everyone has a passionate to teach the students by sharing their enthusiasm for the subject, work in partnership with the students, familiarize yourself with the curriculum, because you have to teach the students means you first familiarize with the curriculum. Without that, you cannot proceed for the teaching. Think about the behavior of the passionate teachers, and think about the education environment where you are going to teach. Okay. So these are the things before starting to teach the students. So you have to think all these attributes. Another important thing, always you have to keeping up to date yourself. Okay, by regularly assess and review their own competency. To assess your own competency, you have to, teachers should keep them up to date. So already I told that poor, bad teachers and the good teachers, but nothing is like that. Now the poor teachers can become the good teachers and the good teachers become the excellent teachers after getting the feedback. Okay, or regularly assess or becoming update himself or herself. So the poor become the excellent teachers. So these are the different way you can update yourself as a teachers. Okay. Textbook, journals, newsletters, guides and reports, conference, meeting, course and medical educations, or membership of the any organizations. Okay. So this by way you can up to date. There is a model for the competency of the required teachers. If you create the center, which is the performance of the task, outside the middle circle is the approach to the task, and the outer circle is the professionalism. Okay. The professionalism is nothing but a personal development of the teachers. Middle circle is how the teacher approaches their task, and the most important is the performance of the task, the technical skills and what a teacher is able to do, which is very, very important. When you are giving the teaching to the students, we have to be in the center oriented, what skills you are giving as a teacher to the students. Okay, that is very, very important. So if you see the professionalism, I already told that performance of the task, which is very, very important. Okay. So for the competency and attributes expected of the effective teachers, technical competency should be there, approach to teaching, which is very, very important, and professionalism. Okay. That is very, very important. Three important things to become a competency to develop as an effective teacher. So many teachers, they not want that they should be given a feedback for their competency. At least they can inquire into their own competency by getting the feedbacks from the colleague. They can ask the colleagues, just give the feedback, or if they are not in that position, at least they can take the recording of their own classes and they can go later and can see that whether their competency is achieved or not achieved. Okay, that way they can do, instead of getting the feedback from the students if they're not that much okay with that. Okay, but the students' feedback is very, very important. That can increase the competency level of the teachers. Okay, or otherwise they can take their own video recording and they can see letters and find out where they lack in competency, and they can improve their teaching as well. So teachers must be evaluated. Yes, like the students we are evaluating, teachers also must be evaluated, which can help the teachers to align their goals with the vision and missions of the curriculum or the institutions, engage in professional learning programs, upgrade skills along with educational improvements, monitor the students learning more effectively, and reflect or do self-evaluations. Okay, like students, teachers' evaluation is very, very important for getting the objective to be fulfilled of the institutions or the curriculum. Before starting the class or any type of planning to take the class or lessons, be preparing for the teacher with the alignments. What is the aim of the teaching lessons, intent learning outcomes, what is going to come after the class, what is the outcomes, learning need analysis, what are the methods you are using, how to evaluate, what is going to be next steps after this class, what way you are testing or assessing, and what is the summary. So alignments is one of the most important things before starting any classes or any lessons to teach the students. Always be fair to your students. Okay, don't give too much burden or too much task to the students. Okay, always to be fair for the effective learning. Get the feedback, repetitive practice, activity should be there, and individualizations learning. Students should have some flexibility. Okay, and relevance, capture of clinical variance. Okay, these are the important things for effective learning. Feedback is one of the most important things, which is very, very important for the better feedback, which can give the better outcome. Okay, feedback from the students is very, very important for the better outcome. Okay, based on the feedback only, you can go through the curriculum if something go wrong. Okay, why there is some feedback is wrong, then you can go to the curriculum, then rectify, so which can give the better outcome. Okay, individualizations. So many students are admitted in the different medical colleges, all are not the same in level, so they are coming to learn the medicines, so they are going through the curriculum. So learners, it is just like a machines, so the learner is coming and they are just going through the curriculum. But like the factory, all the product will be the same, there is no difference in the product. In that motto, we have to think like that, the learners, whoever coming in the different levels, different backgrounds, whatever may be, and the curriculum, we have the certain objectives to fulfill. When the learners go through the curriculum, the product or the output or the doctors which coming out, they must be in the same competency. Okay, that is our motto. Okay, to the standard product, we have to maintain the standards doctors, okay, to come out. Okay, input may be different, but output put is standard, some standard should be there. Collaborations, you cannot think that I can do myself everything. You must have a collaborations for the getting the quality. Okay, so you have to work as a team. Okay, the problems, so many problems can be addressed by the collaborations. Okay, and the quality also increasing. Collaboration between the teachers with the medical colleges, collaboration with other institutions, collaborating between the different phases of the medical educations, collaboration with the healthcare professionals, collaboration with the patients, collaboration between teachers with the responsible for similar program locally, nationally, or internationally, collaboration in the practice. So collaboration is very, very important when you are going to teach some things. If you know that you can give a better things from that institution, you can collaborate with that institute and you can reflect to your students. What the students should learn? Students, it can be specified in the curriculum. What are the objective learning outcomes and competency that only the students should learn. Okay, it is already mentioned in the curriculum. Okay. So nowadays, NMC has given the competency-based approach. I am not going to tell about all the details because it is mostly accepted by most of the institutions in all over the India. Okay. And it empowers the students and points them in the right direction. Competency-based approach is one of the best way to empower the students and points them in the right direction. Okay. And it provides the basis for the allocation of resource to providers. Okay, in the competency-based approach, there is no duplications. Integrated teaching, there is no duplication. The same things cannot be taught again and again. Okay, there is a resource also we have to see. one of the most important factors in all the institutions nowadays. Okay, and help teachers to select the appropriate topics to be taught in the teaching session. Competency events, I told that there is no duplication of the topics. Okay, they have to take the proper topics to be taught in the proper teaching session. And it facilitates mobility of doctors and enables curriculum in different countries to be compared. Okay, so you can compare with the other countries' curriculum, how it can facilitate your students compared to their students. Okay. Now there is a different competency levels for learning outcomes and competency. There are different frameworks as given, but most of the places as a medical educations, they're mostly adopting the CANMEDS as well as the Accreditation Council for Graduate Medical Educations. These are the two framework which most of the medical education, most of the countries is adopting. Okay, for the learning outcome and to measure the learning outcome and competencies. And there is another competency by the Dunde, 3 circular outcomes models and Scottish Doctors Framework, which can have a 3 circles. Already I told that professionalism, approach to tax and performance of the tax, which is very, very important. And it can tell about what a doctor is able to do, how the doctor approaches the practice, and doctor as a professional, what is the role. Okay, these are the very important things, and that can be followed by everyone as a doctors when they are in the institution to teach the students. The epitomize acronyms helps the student to look for all learning outcomes in any patient encounter. So this is the acronym, and which the students can learn whenever they are coming across any patient about the ethics and inquiry, physical examination, investigation and interpretation of the result, technical procedures, what they are going to adopt, what are the diagnoses, what are their judgment, option of diagnosis and clinical judgment, how to manage the patients, what informations they have to handle and what information they have to give, what are the science basis and clinical behind these patients, and the education of the patient and yourself. So these are the acronym for any clinical, any examination to the patients. You have to be very clear. CANMEDS, that is also have a competency framework which has components of professionalism, communicator. As a doctor, as a doctors, you as a communicators, as a teachers, you as a collaborator, leader, health advocate, scholars, as a medical experts. Okay, it is as per the CANMEDS. And as per the ACGME, you can see that as a patient care, what you do, medical knowledge, what you know, professionalism, how you act, interpersonal and communication, how you interact with the others. So these are the different level of competency as given by the different organizations. Okay, and this is the ACGME, system-based practice, how you work within the systems. This is the Brown abilities. They have the 9 abilities to describe the competency of the candidates. This is the GMERE, Global Minimum Essential Requirement, which give it the 7 domain regarding the communication skills, clinical skills, critical thinking and research. UK model, where the doctor as a scholar and a scientist, as a practitioner and as a professionalist. What are the different method of teaching? So nowadays, teacher-centric approach is the student-centric approach. But now we are going from teacher-centered to the student-centered. Okay, teacher-centered, most of the places, it was now slowly shifting towards the student-centric approach. What is the underlying principle for the teacher-centered? What matters is what the teacher teaches. What matters is what the students learn. Okay, so now we are shifting from teacher-centered to the student-centered to help the students. Okay, and students reflect on their content and make their own sense out of it. Okay, it is not like the teacher will just give everything, okay, and just to give the students with the overload, not like that. Now the students will decide and they will reflect the content and make their own sense. Okay, and they have to adapt the curriculum. Okay, student standard, the curriculum adapted to the students. The curriculum which is prepared, that should be adapted by the students. Okay, so the curriculum will be made as per the students, not the students are made as per the curriculum in the teacher centered. And these are the different methods. You can see that different teaching methods which can be used. Most of you people are using this different type of methods. More teacher directed, you can see the left side, more teacher directed than the students directed, project based, problem based, inquiry based, collaborative learning, case based, discussion based, flipped classrooms. These are all coming in the students directed rather than the lecture or examples, worked examples. And if you see the teacher centered, flipped classrooms and student centered, you can see that the high tech, which can give the more students learning capacity. If you see that the graph, high tech students centered, okay, inquiry based learning is one of the most important part for the students. Okay. So which type of teaching method is best for the students learning? Then the question arises, which is the good one? It is not depending on which is the best one. It all depending on what type of students are there, what subject you are going to teach, and what is the gravity of the lessons. Based on that only you can decide what type of teaching methods you are going to adopt. Okay. So most of the places now, the flipped classrooms, they are going to adopt most of the places. Okay. So in that way, the student watch the recorded lecture from homework and then engages in further work and discuss in the class with the teachers. Okay. The already classes which is taken, that video they have going through, or the video classes they are going through, and they can discuss with the teachers. Flipped classrooms. Okay. What are the importance for the teaching methods? The teaching methods is used for ensure that the learning is effective, and involve different methods of teaching, improves the quality of the educations, and it should be student centered, encouraging students involvement and engagement. So the teaching method is such that which can increase the involvement of the students and their engagement. Okay. So where the student engagement is not there, students involvement is then, that teaching methods is not up to level and it cannot be accepted by the teaching institutions, or which cannot give the proper objective what we want from the curriculum. So sometimes the learning is personalized to the needs of the individual students. I already told from the beginning, the students who are coming to the institution, they are having a different backgrounds, different level of IQ. So it should be personalized to the needs of the individual student, what they want to learn, how they want to learn, when they want to learn, with whom they want to learn, and where learn takes place. Say, just leave them. Okay. And they will come across by going through all this scenario, and they will learn the things as the time passes. Already you know that what is the problem with the lectures, because now we are from the lectures, we are going to the flipped classes. So problem with the lectures is only the passive learning. And if you're giving so many things which is not relevant to that class, either it is too advanced or too simple. Okay. So mostly it is a passive learning. Problem-based learning, that is mostly using the clinical parties, and that can be understand and interpret the problem, which is very, very important for the clinical settings. Nowadays, task-based learning.
Sorry to interrupt, sir. The time of 1 hour is approaching.
Okay. 5
we
minutes,
request
5
you to
minutes.
kindly.
Thank you,
Yes,
thank you, sir. Thank you.
Yes, sir. Thank you.
Task-based learning, you can see that developing highly relevant skills, attributes, and competency for the professions. So work-based learning, which can reflecting on their learning experience with the mentor, supervisor, teachers, and the peers. The teachers who are having the experience, they can give their experience to the students. Work-based learning with the person who was already having experience. The drawback in the implementation of work-based learning is the negative attitudes of the teachers can impact the students' learning. Sometimes some teachers, they have the negative remarks which can impact on the students' learning. Integrated approach, which is going in all the institutions now, no need to discuss most of the things, which can widely accepted by the most of the accrediting bodies as well as the institutions, where we can integrate one topics with all the department, most of the departments who are coming cover under that. Advantages of integrations: it can motivate the students, it can having a more learning is more effective, avoid unnecessary reduplications, which is the cost effective, and it can be collaboration way with other department, with the other staffs, and there is the proper communications, good communication among the staffs. Interprofessional education, which is very, very important. Okay, by that you can action-based learning, exchange-based learning, observation-based learning, simulation-based learning, and portfolio for learning and assessment among the professionals regimes. Already I told that too much things, it is overloaded to the students. Information, don't give so much information to the students. Environment is very, very important, which is the soul and heart of the medical colleges. And you have to see the environment, what to be taught, what to be assessed, okay, and the value expressed by the teachers. The aspects of the educational environment, it should be collaborative or competitive orientations, students or teacher orientations, the environment, and it should be supportive to the students. It should be the patient orientation, community or hospital orientations, and it should be research or teaching orientation, that surrounding or environment. So curriculum map is blueprint and curriculum map. It is the same things where it can give the visual curriculum map is give the visual representations which provide the informations and key features of the curriculum. Everything is given in the visually. You can see the map and you can know that what are the things to be taught and what are the key features. And these for curriculum mapping, there is a 6 is curriculum planning, implementation and evaluations, competency-based educations, communicating about the curriculum, continuum and educational across undergraduate, postgraduate and continuing educations, collaboration with all the stakeholders, and changes in the learning outcomes and the educational programs. And they are the potential users of the curriculum, mostly teachers, students, administrators, and accrediting bodies. There can be no single way to study or best way to teach. Different way of teaching is there: small group, lectures, simulators, internet-based, and the students learning from each others. And the problem with the small group teaching is you have to give more attention to the students. The more rooms is required, more faculties is required, team-based learnings, independent learning in the curriculum, directed self-learning, which is the information provider. Teachers act as information provider, as well teacher act as a facilitators. Okay, then familiar with the needs of the learners. So the teacher will act as a facilitators as the information providers in the direct self-learning. Delivering the good lectures, okay, by visual aids, by handouts, learning resources, as the online resources are available. So many resources, including the onlines, teaching and learning in the clinical context, okay. The students enthused to learn in the clinical contents, teacher passionate to teach, and patient willing to contribute. These are the 3 important people who are involved in the clinical settings: students, teacher, and the patient. Students must be enthusiastic to learn, teacher passionate to teach, and patient willing to contribute or provide powerful and rich learning opportunity for the students. These are the different labels. Stimulating. This is very, very important. Nowadays, everyone is utilizing for the instead of the real patients, okay, as in the form of mannequins, as well as in the virtual patients, okay. The regions, already I told that it is a patient safety. You can do the same test again and again till you become competency in the simulation methods, okay, and there will be no risk to the patient, okay. So much time you need, you can do for the testing. E-learning, enhance the learning and facilitate the learning by mobile apps, mixed reality, innovation technology are available now in medical educations. And digital cadavers over high-tech lessons, you can, instead of autopsies or instead of anatomy, you can go through the high-tech lessons, you can go through the images. Telehealth is also another method, okay, which can help in medical education's curriculum for proper learning. Media, like the videos, interactive media, sound files, static images, which is also as a part of clinical vignettes. Augmented reality in educations, interactive classrooms are now, it is there for transforming the educations. E-learning, which is the most important nowadays through internet, which can revolutionize the medical educations. So which is convenience, relevance, individualization, self-assessment, interest, and systematics. Okay, it is convenience. Students can learn anytime according to his own requirement, interest. Blended learning, both the internet as well as the face-to-face instructions can be given in the blend learning. Okay, which can reduce the failure rates, improve knowledge retention, and boost engagement. P2P learning, which is very, very important. Formal and informal settings. So here P2P, one students act as a tutor, one students can act as a students, and they can learn each other's. So finally, and the not the last, nowadays the government or the NMC is going to start the next, okay, which can having a pattern of the examination based on the teaching methods, which can decide the future of the candidates. So day to day, every day, new technology is advancing, and there is challenges in the medical educations which can reflect on the teaching platform of the students. Thank you.
Thank you, Dr. Kusa Kumar Shaha, sir. On behalf of the organizing committee of RFT 2022, myself and on behalf of Dr. Parashakti ma'am, we thank the speaker. He has given a holistic concept of teaching, learning methodologies, and challenges, assessment, evaluation, and he has also given us a lot of different innovative teaching methodologies. And I think it is for us to customize them, and depending upon our institutional needs, resources available with us, we can always customize them and use it for our betterment of our medical education, so that we can proceed with the goal of NMC that has been given with the CBME. That was indeed a very holistic presentation, Dr. Shaha. I thank you once again. And I'm afraid we don't have enough time, but still I take up a couple of questions with the kind permission of the organizers. Shaha sir, here is one question by Dr. Rohit. In your views, what is the most serious problem in postgraduate student assessment in forensic medicine? What changes do you recommend for the same?
I want the periodical assessment, because we are not going the periodical assessment. We are going at the end of the 3 years. We are just assessing the students. And in the case of the autopsy also, most of the times, most of the faculties are not present. The students is going and performing the autopsy. So you have to have some checklist, what they are doing. That is more important. And periodical assessment every 3 months is necessary. And day-to-day portfolio and the logbook, what I told, that is very well. Logbook we are following, but portfolio you are not following. Okay. Which can give the more detailed pictures about the candidates.
Okay. Thank you, sir. Thank you so much. And now I request Dr. Parashakti ma'am to take over the audio, please. Thank you.
So thank you so much, sir, for sir, am I audible, sir?
Yes, sir.
So thank you so much, sir, for a valuable presentation regarding the curriculum-based learning and evaluation methods. Most thing has been followed by us, except without knowing the topic.
Thank you. So, like, ma'am is having some connectivity issues, sir.
Yes, there are some audio issues there.
So thank you so much for the wonderful presentation, sir.
Thank you.
Regarding the curriculum-based learning and evaluation methods.
Thank you.
Most of us are following the same method as sir.
Thank you.
Without knowing the several topics and all, subtopic.
Yes, madam.
Okay. Thank you, sir.
Thank you.
Thank you, sir, and thanks organizing team RFT 2022, especially James. Thanks the entire team. Thank you.
Thank James and Dr. Aarti for giving the opportunity for this presentation.
Thank you, sir. Thank you, Dr. Kusa Kumar Shaha.